Neat Kaur, a study of intravitreal injections. Okay, we start.
Anson Simon. Yeah, Anson Simon, please continue.
Good afternoon, sirs and ma'ams. My name is Anson Simon. The topic for my presentation is to assess the awareness and knowledge of refractive errors in school children amongst the school teachers in Ludhiana. Refractive error is an error in the focusing of light on the retina. Uncorrected refractive errors in children are associated with increased morbidity and have extensive social and economic impacts and affects the quality of life as they turn into adults. A study done by Vijayalakshmi et al. Concluded that uncorrected refractive errors still cause majority of the vision impairment seen in Indian children. Pascal highlighted the positive attitude of primary school teachers towards refractive error, contributing to the prevention of visual impairment in school children. As these children spend a considerable amount of time in the school, it's possible for the teachers to access them easily. Thus, increased awareness and knowledge about refractive errors among teachers may increase the chances for early detection and management, preventing sequelae such as visual impairment and blindness. The aim and objective same as the topic for my presentation. Materials and methods. A questionnaire-based cross-sectional study was conducted among 100 school teachers after obtaining research committee and ethics committee approval. The study was conducted in various English medium schools in Ludhiana after obtaining approval from respective school principals along with informed consent from the participants and graded into knowledge levels based on the percentage scores. The majority of participants were aged between 31 to 40 with smaller proportions in 41 to 50, less than 30 and greater than 51 age group. Female respondents were highly overrepresented at about 87%. 56% of the respondents held a postgraduate degree and 44 had undergraduate degree. The study sample had various experience levels, with most having 11 to 20 and less than 5 years of experience. Majority of teachers had prior knowledge, that is 72%, whereas 28% lacked such knowledge. More than half of the teachers had previous experience detecting visual problems in the children. 97% teachers showed adequate awareness of refractive errors in children, with scores varying and subsequently graded into knowledge levels. Prior experience in identifying visual impairment was strongly associated with knowledge of refractive errors. All 72 teachers with prior knowledge had adequate awareness, while among the 28 without prior knowledge, 3 had inadequate awareness. Postgraduates had a good or very good knowledge level, while undergraduates primarily had good or satisfactory knowledge levels, with very few having poor levels of knowledge. Teachers with prior experience of detecting refractive errors predominantly had good or very good knowledge levels, while those without experience mostly had good knowledge, with few showing satisfactory or poor levels. Among 72 teachers with prior knowledge, main sources were health personnel school programs and mass media, followed by interaction with children with refractive errors, miscellaneous, and information from the parents. Teachers informed by health personnel or mass media showed the highest level of good to very good knowledge levels. Discussion. Refractive errors are a leading but preventable cause of visual impairment in children, with uncorrected errors remaining the most common cause in India. In the study, 97% of the teachers had adequate awareness, with most showing good to very good knowledge levels. The findings align with previous studies reporting high awareness amongst the teachers. Postgraduates demonstrated higher awareness and knowledge compared to undergraduates, highlighting the role of educational level in understanding refractive errors. Prior experience mattered. Teachers who had previously identified visual problems showed better knowledge than those without such experiences, consistent with earlier researches. Prior knowledge significantly was associated with awareness, while differences in knowledge levels were linked to education and information sources. Health personnel and school programs provided the strongest knowledge base. These findings underscore the importance of school-based training and health professional involvement in line with WHE-RESC protocol to strengthen teachers' capacity for early detection of refractive errors. While most teachers had adequate awareness of refractive errors, their detailed knowledge levels varied considerably. Strengthening teachers' education through structured training and interaction with healthcare professionals is essential for better screening and early intervention. School-based training and screening program can aid in early detection of refractive errors and other ocular problems, improving children's vision, academic performance, and overall well-being. I have added the questionnaire, sir. Thank you.
So, Anson, what is the importance of this study in the current scenario?
Sir, the importance is that as we saw,
Mike.
the importance is that, sir, refractive errors is one of the leading causes of visual impairment. If found out early, we can intervene early, and school teachers spend a considerable time with the children. So if they know the symptoms, they can help them seek medical attention quicker, sir.
So what can happen, what can be the complications if these visual impairment, the children, they are not treated on time?
So first of all, the power can increase, sir. In case of refractive errors, it can deteriorate, sir. The condition can deteriorate. It can lead to further sequelae, sir.
Amblyopia.
Like?
Like, sir,
Any amblyopia?
amblyopia, sir. Amblyopia, yes, sir.
Raminder Jeet Singh. Absent?
Is the next speaker ready? All the speakers kindly report and be ready with the presentation.
Have you called all the speakers?
Good morning all. I'm Dr. John Jacob Matthew. I'm from Christian Medical College Hospital, Ludhiana. My paper is on impact of cataract surgery on optic nerve head parameters and SDOCT based study. My co-authors are Dr. Rupali Chopra and Dr. Nitin Batra. Retinal ganglion cells sends axons to the optic nerve head. Degeneration of it leads to the thinning of retinal nerve fiber layer and ONH cupping, which causes visual loss. Optic disc cupping is not only exclusive to glaucoma, but is also seen in non-glaucomatous conditions such as multiple sclerosis, NMOSD, or Alzheimer's. OCT is a non-invasive technique. It precisely quantifies RNFL thickness and ONH parameters, which are crucial for diagnosis and monitoring and progression of diseases. Cataract formation, progression, and subsequent surgery are common occurrences observed during the long-term management of glaucoma patients. While cataract surgery's impact on RNFL is studied in depth, its effect on ONH parameters need further investigations. So our study, main aim was to study the effect of cataract extraction on ONH parameters using SDOCT. We included 60 patients which were 18 years of age and above, diagnosed with cataract and planned for phacoemulsification. We excluded patients that had dense cataract that hinders OCT imaging and other ocular media opacities. And all those patients that we enrolled underwent a comprehensive ophthalmic examination, that is BCVA, IOP, anterior segment evaluation, and fundus examination. All these patients again the cataract was graded according to LOX 3 grading, and the SDOCT scanning was done, and following which phacoemulsification, uneventful phacoemulsification was performed under local anesthesia with an in-the-back IOL. Patients were re-evaluated 1 month post-surgery, and SDOCT was repeated, and all the parameters again were repeated. So in our results, we found that the age distribution, we found a significant patient to be in the age group of 51 to 70 years of age group, and gender, we had a slightly male predominance of 53%. The cataract classification as per LOX 3 grading, we had a maximum subject of PSAC, and signal strength significantly increased from 6 to 8 post-surgery. The cup disc ratio changes were also seen. Our study observed statistically significant decrease in both horizontal and vertical cup disc ratios post-cataract surgery, as you can see in the graphs. Horizontal cup disc ratio changes by cataract type. We found a significant decrease in all three cataracts, but the most significant was seen in posterior subcapsular cataract. And for vertical cup disc ratio changes as well, we found a significant decrease in all three cataract types, but more significant was seen in nuclear and posterior subcapsular. Cup area and disc area were also studied. Cup area showed a significant decrease, although disc area did increase, but it was not significant. So rim disc ratio, there is importance is that it accounts for the optic disc size and cup position and the narrows neural NRRM width, providing a more accurate assessment of disc abnormalities. Unlike the cup disc ratio, rim disc ratio minimizes the confounding effect of optic disc size variability across the population and is more representative of the glaucoma severity, as it accurately measures the loss of retinal nerve fiber layer. So the rim disc ratio that we saw, there was an increase, significant increase in the patient's post-cataract surgery, and rim disc angle was also studied, but it did not show any significant changes. So our study were almost similar to other studies as well, but then there were a few conflicting studies which we could attribute to the sample size changes, along with the OCT machine that they used. Few studies used anatomical positioning system OCTs, and we'd like to conclude that we concluded that optic nerve parameters exhibited notable changes post-surgery. Cup disc ratio significantly decreased in both horizontal and vertical measurements. Cup area reduced significantly. Rim disc ratio increased, and these findings highlight the benefits of cataract surgery in improving retinal imaging quality and refining optic nerve assessment and potentially preventing misdiagnosis of glaucoma-related changes. Therefore, repeat OCT after cataract surgery is essential in all glaucoma and glaucoma suspect patients for accurate evaluation. Thank you.
So, Dr. John Jacob, what are the means shortcomings of your studies?
Sir, my study sample size was only 60, and we used SD OCT that was NIDEC RS 3000 light. So there were a few changes. There were studies that showed using SD OCT with APS system, they had more significant changes.
Now coming to the increase in the rim disc ratio.
Yes, sir.
Right.
Yes.
So you haven't correlated it with the degree of the nucleus hardness, number one, and the amount of phaco energy used.
Yes, sir.
Because that is the main factor
Yes,
that is leading to these changes.
Yes, sir. Yes, sir.
This you could have easily done and made this study more relevant.
Yes, sir.
And in publication also
Yes, sir.
more added value in
Yes,
this study.
Yeah.
Thank you.
Thank you, sir.
Is Dr. Simran Kaur Chawla.
Your good name?
Okay. Vision related quality of life in glaucoma patients.
Good morning, everyone. The topic of my presentation is vision-related quality of life in patients with glaucoma. This was a study done in CMC. I'm from CMC Ludhiana. So glaucoma is a group of progressive optic neuropathies resulting in changes in optic nerve head, initially involving the peripheral vision and eventually the central vision, and it's a chronic and potentially blinding disease. Because of this reason, glaucoma significantly impacts the quality of life, and hence it is important to assess the quality of life in patients with glaucoma. So quality of life is determined by GQL15, which is Glaucoma Quality of Life 15 questionnaire. It consists of 4 factors, which has a total of 15 items. These are the central and near vision, peripheral vision, dark adaptation and glare, and outdoor mobility. So this is the questionnaire of the 4 factors and a total of 15 items. Aims and objectives, it was to determine the quality of life in glaucoma patients according to the severity of glaucoma, mild, moderate and severe. This was a cross-sectional study done in CMC Ludhiana, and it included 150 subjects diagnosed with glaucoma and on treatment for at least 2 weeks. Exclusion criteria was any other disease affecting the RNFL layer and any other significant systemic chronic disease. And ocular and systemic history was taken, ocular examination was done, and including visual field analysis. And according to the mean defects on the visual field analysis, the subjects were divided into mild, moderate and severe groups, and GQL15 was administered to all the subjects to assess the scores. So research and analysis, the age significantly increased in mild, moderate and severe, suggesting that older individuals are likely to have more severe glaucoma. In gender, the significance was insignificant, the difference was insignificant. Education level, it was seen that the higher level of education were associated with milder glaucoma, while lower education levels were correlated with more severe disease. Number of anti-glaucoma medications increased significantly with the severity of the disease. In the GQL15 score, this was the average score, 23. This was out of a total of 75. The average GQL score in mild, moderate and severe group was 19, 21 and 28, and this difference increased significantly from mild to severe, and suggesting that the quality of life worsened with increasing severity of the disease. In the subscales, it showed that the most difficulties were faced in the areas of dark and glare adaptation, followed by peripheral vision with better function in outer mobility and central near vision. This correlates with the natural history of glaucoma, as the peripheral vision is involved first and later involves the central vision. So in summary, age difference was significant. So that means older individuals are more likely to have severe glaucoma. Higher education levels were associated with milder glaucoma and lower with more severe disease. Average EQL 15 scores in mild, moderate and severe significantly increased, indicating a worse quality of life with increasing severity of glaucoma. And the most affected domains were dark and glare adaptation, followed by peripheral vision. So in discussion, it remains one of the leading causes of irreversible blindness worldwide. And there is a need to assess the quality of life for a more holistic approach to glaucoma, in addition to the control of IOP and visual field analysis. And so early detection, effective treatment, and there needs to be a more patient-centered care in mitigating the disease burden. And preserving quality of life should be considered an essential goal of management, equal in importance to slowing the progression. And there needs to be further research on developing culture-sensitive, cost-effective interventions that prioritize patients' daily experiences and overall well-being. Thank you.
So you have rightly mentioned the education level. Right. What about the economic level? Because these glaucoma patients, they are on, sometimes they are multi-drug, right, and that cost is too much for them.
Yes, so we did not take the economic account as such, like we did not divide
No,
the patient.
Kuppuswamy economic scale, how much is the earning, that could have been included in the questionnaire and it could have been done easily.
Yes, so indirectly, like they are related to some education level to some extent, but we did not include the economic factor as such, the scale as a.
That is important because the severe ones were using 4 anti-glaucoma medications
Yes, yes, ma'am.
almost. So the cost of it is quite more. So, and cataract patients are also included in this because you excluded only the retina and other comorbidities.
Yes, ma'am, only the ones very severe disease, only the diseases affecting the nerve fiber layer. Cataract patients, we did not take patients with very severe cataract, maybe just with NS1 to 2, not significantly affecting the vision. And only those patients were taken which were able to do the visual field
Because the
analysis.
glare and dark adaptation, that would be affected
Yes, yes.
in those patients.
Okay.
Okay. The next speaker is Dr. Rajat Solomon, a study of corneal endothelial changes and central corneal thickness in pseudoexfoliation syndrome.
Good morning, everyone. Today I will be presenting on a study of corneal endothelial changes and central corneal thickness in PEX syndrome. In PEX syndrome is an
IT people, we are not able to see the relay. And restart the timer. Yeah, restart the timer, please. Yeah, yes.
Good morning, everyone. Today I will be presenting on a study of corneal endothelial changes and central corneal thickness in PEX syndrome. PEX syndrome is an age-related disorder characterized by deposition of fibrin materials in ocular tissue. This deposit disturbs normal physiology, leading to complications like glaucoma, cataracts, and intraoperative risk. The corneal endothelium is a non-regenerative hexagonal cell essential for corneal hydration and transparency. Gradual load density with age. When cell density falls below less than 800, corneal decompensation and visual loss may occur. This is the pathogenesis of PEX syndrome. In PEX, endothelial cell density and hexagonality are reduced, causing edema and impaired vision, though findings across studies remain inconsistent. Specular microscopy is a non-invasive tool. CCT is a clinical significant in glaucoma risk assessment and has shown variable result in PEX patients, with the studies reporting both thinner and thicker corneas compared to controls. In our study, aims and objectives are to study corneal endothelial changes in PEX syndrome to assess central corneal thickness in patients with PEX. This prospective cross-sectional study was conducted in the Department of Ophthalmology, Christian Medical College, Ludhiana. A total 100 eyes were examined, 50 eyes diagnosed with PEX syndrome and 50 eyes without PEX syndrome. Demographic data and detailed history were recorded. All subjects underwent complete ophthalmic examination include best corrected visual acuity, anterior segment and slit lamp examination. In specular microscopy, corneal endothelial density size, standard deviation, coefficient of variation, externally as well as central corneal thickness was measured. In our study, inclusion-exclusion criteria are patient with pseudo-exclusion syndrome, exclusion criteria, patient with history of previous intraocular surgery, contact lens wear, corneal trauma, diabetes mellitus, patient with previous intraocular surgical complication like subluxation of lens. In ocular examination, we investigate best corrected visual acuity, anterior segment examination. This is our sample size and statistical analysis. In our study, we found a systemic association. Hypertension was significantly more common in PEX patient compared to controls. In central corneal thickness was significantly reduced in eyes with PEX compared to controls. In PEX patient, morphological changes are there. Abnormal morphological was seen in 94% of PEX eyes versus the controls. Polymegathism and pleomorphism was observed in PEX patient. This comparison between the corneal endothelial changes between PEX and control groups. In corneal findings, CCD thinner in PEX, which increased the risk of IOP, which underestimated, and glaucoma. There is a morphological changes, marked abnormalities in PEX, polymegathism, pleomorphism, and higher CV. And clinical relevance are in PEX alters corneal thickness, endothelial morphology, increased risk of glaucoma and decompensation. Routine corneal assessment and BP monitoring are crucial for early detection and intervention. In our study, we conclude PEX is associated with thinner corneas and significant endothelial morphological changes, but not with the lower corneal endothelial density or raised IOP in early stages. Routine assessment of central corneal thickness, endothelial morphology, and systemic factors like hypertension is a vital role for early detection, surgical planning, and glaucoma prevention. Larger longitudinal studies are needed to clarity long-term outcomes and therapeutic strategies. Thank you.
So what is the novelty of your study? Because so many studies have been already done.
Sir,
And what more factors, more parameters you could have included?
Sir, like with PAC syndrome, sir, there's many other factors are also included, like diabetes and cardiovascular factors.
Thank you.
The next speaker is Dr. Lakshit Pasricha. He will be speaking on spectrum of ultrasonographic findings in ocular pathologies and correlation with clinical diagnosis.
Good morning. The title of our study, Spectrum of Ultrasonographic Findings in Ocular Pathologies in Correlation with Clinical Diagnosis. Introduction. The field of ultrasonography has revolutionized the diagnosis of several medical as well as surgical pathologies. It has become an important diagnostic tool for the evaluation of a wide range of ocular conditions. The spectrum of ultrasonographic findings in ocular pathologies is vast and can provide valuable information for diagnosis, management, and follow-up. Our aims to study the spectrum of ultrasonographic findings in ocular pathologies, to correlate the USG findings with the clinical diagnosis, and to study the diagnostic accuracy of B-scan ultrasonography in the diagnosis of ocular pathologies. Materials and methods. This was a prospective cross-sectional study conducted in the Department of Radiodiagnosis and Ophthalmology, Christian Medical College, Ludhiana, in patients above 18 years of age, referred for a B-scan. Minimum sample size of 70 patients was taken. Post the B-scan, the final radiological diagnosis was compared with the clinical diagnosis to determine the correlation between ultrasonographic study and clinical diagnosis. Results. Patient eye distribution. So right eye, we had 31 patients. With the left eye, we had 31 patients, and bilaterally, we had 8 patients. This is a pictograph representing it. Then gender distribution. Our study was predominated by males with 46 males and 24 females. Then results for radiological diagnosis. Most common was cataract, 19 patients, followed by normal findings in 11 patients, followed by vitreous detachment and vitreous hemorrhage in 6 patients, followed by cataract, vitreous detachment, vitreous hemorrhage in 3 patients, followed by retinal detachment, vitreous hemorrhage in 3 patients, followed by just vitreous hemorrhage in 3 patients, followed by all the other cases. This is a pie chart representing all the data. Next is clinical diagnosis. Cataract was again the most common, 14 patients. Then cataract, vitreous detachment, vitreous hemorrhage, 8 patients. Vitreous detachment, vitreous hemorrhage, 7 patients. Vitreous hemorrhage, 4 patients. And retinal detachment, 4 patients, followed by all the other cases. Again, a pie chart representing the data. This is a pictograph representing sensitivity, specificity, positive predictive value, and negative predictive value of radiological diagnosis for predicting various outcomes after taking clinical diagnosis as gold standard. These are some of the images: ultrasonographic appearance of a cataract, image showing vitreous detachment, image showing retinal detachment with vitreous hemorrhage, image showing traumatic cataract with vitreous detachment and hemorrhage, image showing lens dislocation, and lastly, image showing choroidal detachment. Summary. Number 1, role of B-mode ocular ultrasonography established as the first line screening modality for posterior segment anomalies, especially valuable when opaque ocular media prevents fundoscopy. Number 2, spectrum of diagnosis identified. Common, cataract, followed by also vitreous hemorrhage, followed by vitreous detachment. Rare findings, choroidal detachment, neoplastic lesions, and endophthalmitis, 1 case each. In 15.71% patients, there was normal scans. Then number 3, diagnostic accuracy. Accuracy of 88.57%, sensitivity of 88.06%, and specificity of 100%. Strong clinical radiological correlation with high statistical significance. Clinical utility: 11 megahertz high frequency transducer provides high quality real-time imaging, effective for diagnosis, evaluation, and disease monitoring across a wide range of ocular pathologies. Thank you.
Yeah, so excellent study. So how these nomograms, the pictorial depiction can be incorporated in some AI algorithm in the future?
So they can definitely be incorporated.
Louder.
Sir, they can definitely be incorporated, but I am not very tech savvy to know.
So you must.
Sorry.
That is the future.
Yes,
You can learn.
definitely.
Yes. Thank you. Very good study.
The next presentation is a study of ocular profile of patients of visually impaired children in school for the blind. The presenting author is Mr. Ishan.
And sir, what is the meaning of this Sona Lobar Mure? Mic, please. Mic. Yeah, you can wait.
It's a Christian institute. So Sona Lobar Mure is the 3 gifts that the baby Christ, when he was born, were given by the 3 wise men. That is, the frankincense and gold, and then, scent. That is what. So Sona Lobar Mure is in Hindi, and that combination.
Thank you, sir. Thank you so very much. Yes, Ishan. Please restart the timer.
Good morning, everyone. My name is Ishan Emmanuel Khatamala and I'm a third year medical student studying in CMC Ludhiana, and I'll be presenting on my research project titled A Study of Ocular Profile of Visually Impaired Children in Schools for the Blind in Ludhiana. Childhood blindness is a major contributor to the worldwide burden of blindness. The number of children in India affected by severe visual impairment or blindness is 2 to 3 lakhs, and only a fraction of them have been enrolled in schools for the blind. Majority of the causes of SVI and blindness in children are either preventable or treatable. For this very reason, WHO's initiative Vision 2020, the right to sight, has made prevention of blindness in children its primary objective. Data to collect about childhood blindness is always preferred in blind schools than from population-based studies. The aims of the study was to study the ocular profile of the visual impairment and blindness in blind school children in the city. This was a cross-sectional study that was done in 2 registered schools in the city, namely VRTC and Braille Bhavan. WHO's eye examination record for blind children was used. History, visual acuity, functional vision tests, examinations including anterior and posterior segment evaluation along with IOP was recorded as per the protocol. Children requiring further evaluation were further referred to the ophthalmology department in the hospital. Moving on to the results, the mean age was around 12 with a male predominance. Visual loss was present since birth in more than half of the students. A positive family history was seen in 10% of the children. Out of the 100 eyes examined, 65% had no light perception and only 1% had vision more than 6/60. On functional assessment, 1/3 of them could walk independently and only a fraction of them could recognize faces and read print. The most common anatomical site involved was the globe, followed by cornea, uvea and lens. The most frequent abnormality was phthisis. The other major findings were corneal opacity, cataract and uval anomalies. So in surgical history, majority of them had no ocular surgery, and among the ones that were operated, there were cataract, glaucoma, enucleation and other procedures. Congenital anomalies were the leading cause, and other causes included ROP, glaucoma and cataract. Prognosis was stable in 96% of the patients. So the majority of the enrolled children were male, and it reflects referral and schooling biases that are normally seen in blind school surveys. More than half had blindness since birth, and that emphasizes congenital and early onset disease. Only 10% had a family history suggesting regional or reporting differences. Associated disabilities were rare, and it was 2%, possibly due to the underrepresentation of children with multiple impairments in blind schools. The most affected site was globe, followed by cornea, uvea and lens. The leading cause was congenital anomalies, and preventable or treatable causes accounted for 1/3 of the entire cases. The previous ocular surgery was low, and it basically indicates gaps in timely access to surgical care. So blind school surveys remain a practical method to study childhood blindness, though there are subjects to biases. Findings emphasize the need for early identification and intervention. This includes neonatal screening and timely pediatric ophthalmic care. The results also underline the importance of strengthening rehabilitative and educational support for these children. So in conclusion, I'd like to say that childhood blindness in the city was predominantly due to congenital anomalies, with globe affecting being the most affected site. Around 1/3 of the cases were preventable, mainly due to ROP, cataract and glaucoma, highlighting missed opportunities for early care. Very few children benefited from refraction, confirming that most had irreversible pathology. This shows the need for prevention rather than late treatment. Findings are consistent with other Indian blind school surveys, highlighting a national shift from corneal causes to congenital or developmental causes. Periodic blind school surveys can be done every 5 to 10 years, and they can be a practical tool to track these trends. Early screening, timely intervention and rehabilitative services are essential to reduce this burden. Thank you.
Excellent presentation, and the study was very well conducted because the magnitude of childhood blindness is so high, and it is a huge responsibility on the society. So to make the national programs, or we need to know what is the exact magnitude. Did you include the socio-economic strata of these patients?
No, ma'am.
socio-economic strata of the children who were there in blind school?
No, ma'am, it isn't part of the protocol.
Okay, because there is a majority of patients who belong to the lower socio-economic strata who are not even able to enroll their child in the blind school.
That's true. Thank you.
So these two speakers and Dr. Raminderjeet Singh, are they here?
So we mark them absent. Dr. Jasneet Kaur and
Just the last speaker.
okay, okay. Okay, so we still have, I didn't see this page. Yes, I didn't see this page. The next speaker is Dr. Vaishali Rakheja. She will be speaking on clinical and demographic profile of oculoplasty patients in a newly established tertiary care center. It's not here. Dr. Mehak Mangla is here. Dr. Mehak.
Any speaker present here? Okay, so thank you so very much. Kindly come on the stage for a group photograph, all the speaker. So many absent.
So many absentees. Accept हो गया पेपर.